Hello and welcome to another episode of Tea Time and Gossip with me, Dr. Aparna, and today I am going to discuss everything about psoriasis. So let's start. We all have a lot of myths revolving around psoriasis, which says that it is not curable because it is autoimmune disease. And if you go to the conventional medicine, people say that you have to live with it throughout your life. But as a functional medicine expert, I have seen in my experience that it is curable. You can very well come out of it, manage it, and cure it. That is very important. Now let's understand what is psoriasis. So it's basically an autoimmune condition. It is chronic, it is non-infectious skin inflammation that causes a rapid buildup of skin cells. Now, what actually happens? That these skin cells replicate at an aggressively rapid rate, producing nearly 8 times faster than the normal cycle. But the rate at which the new cells are formed is more and the older cells are sloughed off is less. So that is, there is a buildup of the new cells and the sloughing off of the older cell is not happening. This causes a buildup of the skin surface. If you see through the microscope, the epidermis is quite thick and scaly in psoriatic cases. These patches, which are red or pinkish with maybe a silvery scales, are called plaques. It can be itchy, it can be painful, it can have a lot of burning sensations. Now, these psoriasis can be of 5 types. Number 1 is a plaque psoriasis, in which there are raised red patches which is covered with a silvery white buildup of dead skin cells. In guttate psoriasis, which is another form, it generally starts in the childhood or the young adulthood. There are small dot-like lesions, now this guttate psoriasis is generally very common. Then we have the inverse psoriasis. Inverse psoriasis appears like a very small red lesions in the body folds, like under the arms or behind the knees. So if you are having these red lesions in the body folds, it can be an inverse psoriasis. Then pustular psoriasis, these are characterized by white pustules which are surrounded by the red lesions. Now the another form is erythrodermic psoriasis, which is very fatal or the life-threatening ones. In this, there is a lead lesion which is widespread over most part or whole of your body. Now, talking about another symptoms of psoriasis, your skin is dry and cracked. There is itching, burning sensation, or even soreness of the skin. Now, the psoriatic patches or the plaques come in cycles. So, there will be flare-up, which will subside. Then again, it can flare up and subside. Psoriasis can also affect your nails, leading it to pitting, abnormal nail growth, even discoloration of your fingernails and toenails. Sometimes the psoriatic nails may even separate from the nail bed or even can crumble. Very important aspect to discuss is that according to functional medicine, psoriasis is not just an skin inflammation. It is basically the inflammation of your system. It's a systemic inflammation which exacerbates as an skin infection or skin inflammation. Now, this psoriasis we have seen to be associated with many of the metabolic disorders. Now, if the psoriasis is affecting your joints, it can lead to psoriatic arthritis. If it affects your gut, your bowels, it can lead to inflammatory bowel disease in which you have an alternate constipation and diarrhea. Psoriasis has also been linked to stress, anxiety, depression, a person who is having chronic stress. Psoriasis can lead to inflammation of your eyes also, leading to uveitis. Then it has also been related to heart diseases, atherosclerosis, insulin resistance, PCOS. Then we have seen with a lot of hormonal fluctuations, then non-alcoholic fatty liver disease and many more. Let's understand the root causes of psoriasis. It is an autoimmune condition, but why is it happening? Majority of the time we have seen there is no hereditary, it is not by birth, but still the person develops psoriasis. Saying that it is idiopathic, it is autoimmune doesn't solve the answer. we need to find out why is it happening. So let's explore various causes of psoriasis. Psoriasis has been linked to immune system dysregulation basically. So in psoriasis, what happens? There is an overactivation of T cells happens. So the skin surface is lined with number of or more than needed T cells. So these T cells are basically white blood cells which help us in protecting from infections. But in psoriasis, there are overactivation of T cells and they are dysregulated now. So they will activate the release of inflammatory cytokines which are TNF alpha, IL-17, IL-23, which will target the skin cells to proliferate. It will cause the inflammation leading to patches or plaques of psoriasis. Gut health is very, very, very crucial for how our body is existing. For any disease, anything, if we are having something in our body, our gut health should be monitored. Similarly, in psoriasis also, we have seen in cases where there is a gut dysbiosis. Now, what is gut dysbiosis? That your gut is having predominantly more of harmful or the bad bacteria. So, in that cases, the immune system gets dysregulated. A lack of beneficial bacteria or the overgrowth of the harmful bacteria leads to imbalance of your immune response. Your immune system is dysregulated. It will cause an inflammation. It will increase the inflammation, which will lead to psoriasis or it will trigger psoriasis. Now, we have also seen that in gut dysbiosis, Akkermansia and Faecalibacterium, these two types of bacterial strains which are anti-inflammatory in nature are missing. Now, this impacts the integrity of the gut lining. So now the gut lining is disrupted and the leaky gut is caused, which will increase the inflammation of the system, exacerbating the skin inflammation as a psoriatic patches or plaques. Now, what is leaky gut actually? So you must have seen the tea strainer in your houses through which you stain the tea and the residues are left behind in the strainer itself. Now imagine there is a holes in the strainer. So residues will also come along with the tea, right? Similarly happens if your gut lining is disrupted. Okay? Molecules, the toxins, the undigested food particles or even the microbes which should have remained within the gut itself, now they can enter the bloodstream through that leaky gut lining. Okay? When they enter the bloodstream, it causes the toxin load to increase in the bloodstream, which increases the inflammation of the system, causing various skin issues and other metabolic disorders also. Now, your gut is a critical site for immune system activity, with large portion of the body's immune cells residing in the gut-associated lymphoid tissues. So, when the gut is not functioning properly, there are more of harmful bacteria, the leaky gut is there, the immune response gets dysregulated, the inflammation will increase. Now, this will cause you an autoimmune condition, which is called psoriasis. Now, talking about the stress and psoriasis. So, the stress and psoriasis are a vicious cycle. If a person is having chronic stress, the cortisol hormone is dysregulated. Now, this will increase the inflammation and person can exhibit the psoriatic patches or plaques because the inflammation increases. This is one. Number two, if the person is having psoriasis, then also the stress will increase. This will lead to anxiety and depression, which will again further cause the cortisol hormones to dysregulated, leading to psoriasis. So psoriasis and stress go hand in hand. So it is very important to manage the stress levels so that the psoriasis symptoms should not trigger, should not increase. Number one. Another thing, when there is a chronic stress, then the adrenalines are released. Many of the neurotransmitters which are responsible for increasing the inflammation are released. So this also increases the inflammation. Then cytokines are released which are already more in the psoriasis. So all this leads to increased inflammation. systemic inflammation which causes the skin to show psoriatic patches or plaque. So remember, stress and psoriasis are a vicious cycle. If stress is there, psoriasis can develop. If the psoriasis is there, stress level, anxiety increases. So you need to manage your stress levels. Coming to the hormone levels, we have seen in our experiences that when there is a fluctuation in the hormones, when the hormones are imbalanced, now this can also trigger your psoriasis. So basically in puberty times, the hormones are fluctuating. So this is the time when the people who are predisposed to psoriasis, their psoriatic patches can increase because the inflammation increases. Number two, we have also seen that in adolescents, since there is hormonal fluctuations, that time also because of this systemic inflammation will increase and the psoriasis symptoms can develop or can trigger. Number two, during the menstruation, the time when you are having your periods, at that time the estrogen levels drops. Estrogen has been linked to being anti-inflammatory. So your estrogen levels has dropped down, leading to increased inflammation, which will exacerbate or trigger your psoriasis. Then we have also seen in pregnancy, the female who are having the psoriasis issue have shown betterment of their psoriatic symptoms during the second and third phase of pregnancy because their estrogen and the progesterone level is built up. During the pregnancy, estrogen and progesterone levels are high. So since they are anti-inflammatory, the psoriatic symptoms are relieved. Now similarly, in menopause, since the estrogen levels declines rapidly, so psoriasis symptoms aggravates during your menopause cycle. Talking about the PCOS, during the PCOS, your testosterone levels are increased, which leads to your acne issues or the unwanted hair growth. This can also lead to systemic inflammation, triggering your psoriasis. Similarly, insulin resistance, which is basically seen in obesity cases. When the insulin resistance is there, that means the insulin levels are high in the blood. High insulin level in the blood means the glucose is also high in the blood. That means the fungal infections will be increased, which will cause systemic inflammation, and this will also trigger your psoriasis. Apart from this, hereditary or the psoriasis running in the family is one of the reasons. Dry and cold weather. So during the winters, when the air is cold and dry, the sunlight is less, humidity is less, then also your skin gets irritated and it can exacerbate psoriasis. Many of the bacterial infections like streptococcal throat infections, commonly known as pharyngitis, has also been linked to psoriasis, especially in children or young adults. Now, these are characterized by small drop-shaped lesions that appear suddenly on the trunk, limb, or scalp. Similarly, Staphylococcus aureus, this type of bacterial strain can also be related to psoriasis, which can worsen your psoriasis symptoms. Now, viral infection is not directly related to psoriasis, but if the viral infection trigger or dysregulate your immune system, then psoriasis can be increased. But yes, psoriasis has been linked to fungal infections, candidal species, especially if you are following an unhealthy diet, like you are having a lot of processed foods, a lot of sugar intake, a lot of unhealthy fats, then systemic inflammation will increase and can cause you psoriasis. Similarly, if the gluten sensitivity is there, then it can also trigger your psoriasis. We have talked about what is psoriasis and what can be the different root causes and what can be the different metabolic disorders related to psoriasis. Now, you have psoriasis, you have come to know. Now, what is the solution? Solution is on 3 lines of action. Number 1, your diet changes. Number 2, your lifestyle modifications. And number 3 is your supplements. First, we will make you run through some blood test, some gut test to know about what is going inside your body. Based on that, we will recommend some of the supplements. Then for the dietary changes, it is very important because diet plays a major role in curing anyone's disease. You have to remove wheat, you have to remove dairy from your diet, you have to remove sugar in any forms in your diet, because these three are the main and inflammatory foods. So once you remove all the inflammatory foods in your diet, you will see some drastic changes in your psoriasis. Then you have to include some foods which are anti-inflammatory. Now these are omega 3s. So from where you can get omega 3s? Omega 3s you can get from avocado, you can get from coconut oil, you can get from A2 ghee, you can get from seeds, you can like the flax seeds, the chia seeds. Then you have to include, major part of your diet should be proteins and fats and carbohydrates, but not in the form of wheat. As I have told you, wheat has to be eliminated. Coming to the lifestyle changes, vitamin D. The source of vitamin D is the sunlight. So sunlight exposure is very important for psoriasis or for normal person to remain healthy, because we need to connect with the nature. Sun is provided to us by nature itself. If we go against nature, we are bound to get unhealthy. Now people say that I am not able to take up the sun. If I go under the sun, my psoriasis issue increases. For this, I have always say that sun is never bad. Sun is always and always good, because that has been given to us by the universe. Now, if you are not able to take up sun for a longer duration of time, start with remaining in sun for maybe 5 minutes, 10 minutes, and that too you need to expose yourself to the sun when it's not very intense, like in the morning hours, maybe in the evening hours. Then avoid using any of the commercial soaps on your skin, because in this way you are removing the sebum layer of your skin, which protects you from any of the infections. If you want to apply anything on your skin for cleaning it, you can use some organic soaps, or you can use a basin very normally found in the kitchen, that you can apply on your skin and have a bath. So overall, having a good anti-inflammatory diet, having good sunlight exposure, using organic products for your skin, wearing loose cotton clothes, avoid using any creams or lotions on your skin, having good supplements which are customized or needed on the basis of your reports will help you to get out of this autoimmune condition and clear off your psoriatic issues. Hope this episode helps you. It will also give you an option or an insight into different therapies, different other medical lines which you can use for treating your psoriatic issues. So if you have any further comments, any queries, you can connect to me through the comment section or on my mail ID. Thank you so much. मिलते हैं नए एपिसोड में. It's tea time and gossip with me, Dr.